Hello everyone. Today we will discuss about one of the important practical situation in ICU setups, that is endotracheal tube positioning. We all know that initiation of mechanical ventilation is a critical period during the course of a patient stay in ICUs. So we have to consider few important points during intubation. Today we are mainly discussing about the ET tube positioning. A rough guide is at the level of teeth. At the level of teeth, we have to look for the markings. So a rough guide is nothing but it should be marked as 18 to 21 centimeters if the patient is female, and for a male it should be 21 to 23 centimeters. So these markings what you are seeing here at the level of teeth, these are the numbers we have to remember. So approximately we can consider 20 for females and 22 for males. This is the first point. Then we have to carefully auscultate chest to avoid the complications of right mainstem intubation. So always we have to practice 5 points auscultation technique. That is, first at the level of epigastrium, there should not be any sound, so that we will be sure that it is in the airways. Then other 2 points are in the bilateral axilla, we have to auscultate. Then at the anterior part, that is bilaterally infraclavicular chest areas, we have to auscultate. So these points will help us in confirming the right position of endotracheal tube. However, positioning should always be confirmed with a chest X-ray, so that we can avoid again the commonest complication, that is right mainstem intubation, which we can see in this particular chest X-ray. So always post intubation get a confirmatory chest X-ray. So these are few points we have to follow whenever we are initiating mechanical ventilation in ICU setups. So just to summarize, a rough guide about the position of the endotracheal tube at the level of teeth, confirmation of the tube in proper position using 5 points auscultation method, and a confirmatory chest X-ray to avoid the common mispositions. Hope this short video is helpful during your ICU duties. Thank you so much. See you in next video.